Hi, my name is Ashley Graham.
And I'm Erena Ghirmai. Today we'll be talking about the human immunodeficiency virus. The human immunodeficiency virus, also known as HIV, harms your immune system by destroying the white blood cells that fight infection. This puts you at risk for serious infections and certain cancers. HIV can be spread through unprotected sex with the person who has HIV, sharing drug needles, or coming through contact with blood of a person who has HIV. Women can also carry it and pass it on to their child during pregnancy or childbirth. There are three stages to HIV. Stage 1 is acute HIV infection. During this time, you will feel most of the symptoms, which include fever, chills, rash, and night sweats. During the second stage, clinical latency, people who are taking medicine to treat HIV and who take their medications the right way every day may be in this stage for several decades because treatment helps keep the virus in check. Lastly, stage 3, acquired immunodeficiency syndrome, also known as AIDS, is the final and most severe stage of HIV infection. Because HIV has severely damaged the immune system, the body can't fight off opportunistic infections, and without treatment, people with AIDS typically survive about 3 years. Although there isn't a cure for HIV and AIDS, there are medications that help alleviate the symptoms and prolong life expectancy. Some of these medications include reverse transcriptase, protease, fusion, integrase, and multi-drug combinations.
In the US alone, there are 1.1 million people living with HIV, and only 1 in 7 are unaware of their status. And this is important because the epidemic of HIV remains an issue after so many years. In the US, the main factor that contributes to the number of new cases are that it's driven by sexual contact, which is unprotected, and it's also heavily concentrated in key populations, such as gay men, and then also African Americans, which are far worse off affected across all key population groups. And then also data also shows that there are increasing levels of injecting drug use linked to an epidemic of opioid misuse, which are threatening the gains made on reducing HIV among people who use drugs. In the US, most people do not get treated because of self-guilt and negative feelings. In 2017, there was reported that there was 36.9 million who were infected with HIV, and only 21.7 million did not seek treatment. And this is because in the US, most have reported self-guilt, experienced social discrimination, and institutional discrimination. And disparities contribute to HIV treatments are poverty and poor access to healthcare. Because there is no cure for HIV, the antivirus emergency team focuses on primary prevention, such as having schools provide condoms. Then there's also HIV and sex education. Unfortunately, there are only 8 schools who discuss sexual orientation, and the rest focus on abstinence of sex, which is alarming because many young ones aren't taught safe sex, which poses a threat to contracting STIs. And then there's also prevention programs and key harm interventions. An example of one is the Let's Stop HIV Together campaign, which raises awareness about HIV and its impact on the lives of all Americans.
If these preventions are not taken seriously, then chances are it can lead to these consequences: poverty, depression, mental health disorder, anxiety, and even death.
So, in conclusion, HIV is an epidemic issue that still needs to be addressed and be made aware of. Health organizations should give more opportunities to increase the knowledge of ones susceptible to contracting HIV, and educational systems and schools should provide primary care prevention programs to help to decrease the rate of deaths due to HIV. Thank you.